That's why usually
Yeah.
I'm more on the heart than the business.
Helping people.
Yeah.
This guy is about money.
I think when we goes back our first day in Antler, I think even me don't want to invest in Healthpro.
Yeah.
Like, let's say example, this month 1,000 shift fulfilled. Next month will be 1,500, and we help more workers.
Yeah.
We help more families.
I sat down with Vika and Rendy, founders of Healthpro from Indonesia. We talk about their journey building a startup that connects healthcare workers with clinics and hospitals. Let's dive in. Let's start off with something simple. Maybe tell us a little bit about your startup.
Maybe like introduce myself again. My name is Rendy.
I'm Vika.
We are both co-founder of Healthpro, on-demand healthcare workers platform for healthcare facilities.
Yeah, Healthpro basically is a on-demand healthcare workers platform for hospitals and so for clinics. So let's say if the hospital or clinics needs a temporary workers or gig workers, or we can say like a locum like workers for a doctors, nurse, or midwives, or another type of the healthcare workers, then we can provide for the hospitals and also the clinics.
Vika, why did you start this?
Yeah, because I'm a nurse actually. Yeah. So prior I built Healthpro with Rendy. I work at a startup, and prior work at the startup, I work as a nurse. So mainly it's basically the starting is I've seen that a lot of my colleagues like doctors or nurse are struggling with the shift inside the hospitals. So it's really hard to balancing between the lives and also the works or the shift at the hospital or clinics, right? Because in Indonesia, double shift is really like every day. And a lot of my colleagues like see about, hey, is there any opportunity that more flexible or balancing the life bit and also the job itself? There is still none. Because if let's say they're married and have a child, right, and should taking care of the family, and then usually they decide to then off the job. So at that time, that startup is only provide the home care services. But the thing is, healthcare facilities is not only craving for the home care, right? They're also craving for inside the hospital. Inside the hospital or inside the clinic itself, like inpatients or outpatients in the hospital itself. So at first, we're just like freely to help. But because of those startup only handle for home care, I just like happy to help.
And then that's why I jump in. I see the opportunity. I see the opportunity, and then while we see to another startup across the globe, we saw in US, this business model is quite mature in US. So we just think, why not? We are implementing that business model also in Indonesia. That's why we are both joining Antler and then creating Healthpro, crafting anything, doing market validation, doing product validation, and then Healthpro starting in 2022, and then got our first payable client in June 2022 also.
Okay. Wow, interesting. Just because of your out of your heart to help others, it spun into a business. Good for you. Okay, so we know a little bit about your business already. Let's talk about you guys running the business. Okay, tell me, what are some of the biggest challenges you face or you had to overcome since you started this business, since you started Healthpro?
Biggest challenge since beginning is to create awareness that this business model can implement in Indonesia's market. Because previously for on-demand, the market only aware about home care, but for locum or inpatient setting, they know they need this, but there are no regulatory that really said that this can be done by themselves. So that is the first challenge. But while that's why we have a good strong network also with Ministry of Health. We're doing regularly discuss with them, and Ministry of Health said that this is the one pillar that we need to solve, not now but in the future. The pillars is workforce, healthcare workforce, that going to be a big challenge in the future. So while they see Healthpro is already exists, so they just say, please do it by a good way lah. So make sure the the license of the doctors is legit.
Yep.
Make sure you provide the fitted healthcare workers. So let's do it. But because for doctor is shortage in Indonesia, but for a nurse is surplus.
Right.
So I think, of course, the healthcare facilities need to get the best healthcare workers that they hope.
Yeah.
But to hire these healthcare workers as a full time year by year, I think there's going to be challenge also for them.
Right.
That's why we need to create a product that can help them connect easily.
Right.
That is the original business that what we want to provide now.
Yeah. Yeah.
You are a startup founder, right? So you have to many times you have to negotiate with the big boys.
Yeah.
What are some of the challenges in this kind of negotiations, right?
Yeah. Yeah, actually, of course, the first challenging because in healthcare industry, especially for the hospital and clinics, they are keen to partnering with the reputable partners, right? Just like unlike us, right? At first, once we pitch to the one of the hospital, I mean reputable hospital, of course they are asking about, hey, do you have experience about this refer or giving the locum workers, or how's about the quality and etc., right? But the thing is, they are aware that we can help them to solve their problem. They are keen to partnering with us. And
Because you
from
deal
there,
directly with the problems that they face
every
day.
day. Every day.
What about, now we talk about the other side of the equation.
Yeah.
What about nurses? Are there any, sometimes, are there any unreasonable expectations? Share with us some of the interesting stories.
I think because this is on demand, most of our workers is we provided a daily basis.
Daily what?
Daily basis.
Shifting
So every
for
day.
Daily basis.
daily basis. And sometimes they don't show up. With that. And then the story, but the story is quite interesting. So we have one nurses that already goes to the hospital and ready to do the job, but they have got sick right in front of the hospital.
Right in front of the hospital.
In front of
They call you, I sick.
Yeah. But we know she's really sick. I think she got a stomach
ache.
I think GERD or something like that. And then, but because our business model is when we got one order, we engage maximum three available one.
Okay.
So instantly, when she said, "Hey, I got sick," I just go back to
Become the patient now.
become the patient
now.
And then instantly we check to another nurse, and then the nurse goes to hospital, and then we fulfill the
So you
the order.
actually have standby nurses. So in case any one of them they are scheduled for this shift, they will actually back up. And I mean, if they have issues, they will come and back up. Oh, that's interesting. That's very efficient. I'm sure the hospital must appreciate it a lot, right? Because you won't have a nurse who suddenly say, I cannot work for whatever reasons, and they'll be stuck there. Now, let's talk about you guys a little bit. So, maybe can you share with me in this entire journey, is there anyone who has helped you as a founder for the startup? Anyone who has advised you or guided you?
I think because we are joint Antler program, Exerting Asia program, and some Bone Bilo program that we are joined as a cohort, we got help from not only founders but also the partners from that program also. We know we need to learn more to accept the challenge, to solve the challenge while we grow. That's why for every aspect we got some help, like impact. We got help from Suraj from Bone Bilo. He helped us to crafting how to measure the impact, how to build and showing the impact aspect about our startup. And then we met also with Craig. Craig is quite straightforward.
Yeah.
When we talk about Craig just care about the numbers.
Who is Craig?
Craig is a
From
partner of
Exerting
Exerting
Asia.
Asia.
Oh, okay.
Yeah, Craig is quite straightforward. Just he always said, harness about the numbers, harness about your growth, and also Antler also helping us about
from zero.
from zero, even only I think when we goes back our first day in Antler, I think even me don't want to invest in Healthpro.
Yeah.
If we remember at that time, I will say, hey Rendy, just go, go off. But they help us a lot, especially to relate with the current situation also with Indonesian
So they are like your cheerleader to cheer you on.
Yeah.
That's really important, right? Because you can get really tired as a founder.
Yeah.
You need someone to cheer you on so that you
Yeah.
just get refreshed, the energy to go again. Now, then talk about the two of you. Okay, have you guys argued about anything before? I'm sure there must be conflict, right? So what is the biggest conflict that you all had to clash it out on?
The biggest conflict is actually because my background is a nurse, right? So I come and deal with the business with the heart. So that's why usually I'm more on the heart than the business.
Helping people.
Yeah.
This guy is about money.
So that's why
I need to make sure Vika
making money.
making money.
Not just helping.
Yeah.
You need to put food on the table. Also.
Yeah. Especially those for about the quality, those for about the numbers, etc. So yeah, Rendy maintain me, helping me about those.
Even prior we come to this, I just like Vika, hey Vika, just don't think to help only nurse rather than monetize them, because I just think to monetize healthcare workers also by themselves to create a training, to create some program with them. But Vika's think that let's make it free first and then doing like that. But I think that's some balancing also from us. But and also what we are learn is sometimes it's not 50-50. Sometimes maybe if I about like say about product or technology, maybe I have more experience, so maybe it's gonna be 80-20. Or when about operational, I don't really facing operational every day. Maybe Vika's purposes will be 90-10 or something like that.
Yeah.
I think that is the first. This is the number one, right?
Yeah.
about businesses, about how to maintain.
It's amazing because Vika is about the people, but if you are just focused on the people, you tend to neglect the business side.
Yeah.
And you need the business side, the funds to come in, so that it becomes a circle. Then you can continue to help. So I think you guys have a very good synergy that you, like you say, I like the word you use. You balance out each other, so that you don't just focus on money or the operations alone, but you don't just focus also on the helping others alone. It comes together, and then I think you can really synergize. Okay, then what is the biggest sacrifice you guys made as a startup founder?
My biggest sacrifice is time. Yes, I can say that. Because we are really put all our time to my time to Healthpro, and then build all the product, build all the businesses, and then sometimes it's not going well, sometimes going well. That's and maybe we are not, and the fact that we are not that have that privilege to do that often. So I think that is the biggest sacrifice. Time lah.
What about you, Vika?
I think I agree with Rendy, right? Because not only time actually, but also everything that we done is we do all. So meaning like our every day doing everything, even like after working days, but we still talking about it, and whenever the team that want to reach out, then we will discuss. So even like, yeah, it's more on the everyday sacrifice, right? Because we are doing this with our hearts and to helping people and also maintain the business as well. So yeah, we do everything that we can do to this.
So based on what you shared, is there any moment in this journey of yours where you felt that the sacrifice was worth it? Is there any high that justified the sacrifices that you made?
Wow.
Yeah.
I think if what is the best is in the end of the month that we need to wire healthcare workers' salary.
Yes.
So because we ask feedback mostly to our workers. Sometimes they said that, hey, because I work with Healthpro, I can give my son, and then pay the bills of their education, and something like that makes us live every month. That's why every month we have some thing that we said that, hey, while we wire, let's smile, and then click the wire, and then we are real think to, hey, let's do it next month, and then let's get, if let's say example this month 1,000 shift fulfilled, next month will be 1,500, and we help more workers. We help more families from that workers, because the workers have husband, have children, maybe still have parents also in their home waiting for we wire the salary. That's why what we are the biggest that we are really stick currently is pay or wire salary right on time. So
because it's really matter.
Yeah, really matter. And then after we wire, we just imagine their smile and also their family smile.
Wow. I don't see how he is focused on operations after he shared this.
Because
it's good sign, right?
because actually in the first sometime I have a flat face when I wire that, and then Vika, hey, smile when you wire. Okay.
Yeah.
I think in the beginning it's not natural, but I think while I asked the business development team, hey, do you have a feedback from this worker? Hey, the worker said that blah blah blah. They pay their education right time. They can give their family while Lebaran allowance last month. I think that's the beautiful one from doing this business.
I think that is really the motivation behind it, right? A lot of people say if you work just for the money, it will not last long. But you have a very beautiful motivation behind to help these gig workers. Can I call them gig workers?
Gig workers.
Right? Who have family to support, and you're bringing and helping them to find part-time work that they can still take care of family and still put food on the table. So that's really beautiful, right? That's a really wonderful story. I'm encouraged by your sharing. I hope even if we put out this video, many more people will be encouraged by your sharing also. What is the advice for people who wants to do startup? After having gone through all the ups and downs, when you're beginning, you're not sure, to now you have a lot of good traction. What is the one advice you would give to startups, to founders who want to start a new business?
Just keep swimming.
Keep swimming.
What Dory said, right?
Keep swimming.
Keep swimming. Whatever it is, whatever the pathways will goes or everything, just keep swimming. Because we know every time that we are remember that what's the goal that we want to achieve, then just keep swimming, whatever the obstacles is, whatever the conditions or situations. Because we already facing like a lot of tears, right? A lot of problems and etc.
And then the most important thing is you need to focus for one thing in the beginning. I think this is the big learn also from Healthpro. I think Healthpro in the first 6 months we are not
focus
also, and that's not going well. We are stagnant around $400 and revenue monthly up to just $1,000. And then after we are focused, in that time we focus only for on-demand shifting for inpatient setting, and then we easily goes to $10,000 monthly revenue only in 1 month. So if we do many things, we will facing many obstacles. If we do one thing, we will facing obstacle. So, but only one obstacle. I think it's still good lah to do.
Wow, that's really critical advice, because a lot of founders, right, they will try to do a lot of things. And then once all the problems come in at the same time, then they get distracted. And you are a testament to it. Once you start on one thing, you can see that growth. So I think that's really wonderful advice that you can give to founders.